It is my pleasure today to not only introduce a good friend, but to introduce the new medical director of Plexus Worldwide, Dr. Dennis Harris. Now, Dr. Harris, you did something pretty unique back in 1972. What was that?
Well, that was when I started the first chronic pain control program in the Southwest.
Now, you're not only a medical doctor, but you've also got some specialties which relate to pain.
Yes, that's true. My specialty is actually physical medicine and rehabilitation, but I also have a specialty of pain management, and that's really what I've concentrated on during the last 40 years.
Now, we have 4 of your products already in Plexus, and we're hoping to add more, because not only do you manage pain and put programs together for that, you also are very inventive, very creative in producing a variety of all-natural products for various health ailments. Is that correct?
That's correct, and you know, I'm looking forward to Plexus having those products in their inventory. I think that it gives us the opportunity to really be able to help so many thousands and thousands of people that really are suffering now and have no answers.
Well, we just had a survey done recently, and 92% of the people that are involved with Plexus are involved because of the products. So to have a product expert along with us, and now our new medical director, we're thrilled.
I'm Dr. Dennis Harris, the Medical Director of Plexus Worldwide. I have to tell you that I am really excited about introducing Nerve Health Support, the newest product to come into the Plexus Worldwide inventory. I'm excited for a couple of reasons. First of all, 80 million people in this country have either nerve damage or neuropathy. It is one of the most frustrating conditions that physicians have to deal with, and also one of the most frustrating things for patients to have to deal with. Why is that? Well, I've got to tell you, not only does nerve heal slower than any other tissue in the body, but in addition to that, the real problem is that there is no medication that will heal and regenerate damaged nerves. Absolutely none. So the poor doctor who may be trying to help you out really has no way to do that effectively. So instead, they give you medications that are very powerful, that have a lot of side effects, and all they do is cover it up. They mask it. It's like putting on a mask, taking it off, and looking in the mirror, and guess what? The result is still there. So you can't change that. One of the things that we know is that here in Plexus, where weight loss has been a focus, and very effectively dealt with Plexus Slim and the accelerator, we see a lot of diabetics or pre-diabetics. These are people who have typically a little bit of excess weight or a lot of excess weight, and that makes the diabetes even worse and more difficult to control. Well, it's not uncommon for people to lose weight on Plexus Slim and Plexus Accelerator and find that it's easier to control their diabetes. They may be able to get their medication levels down. They may be able to eat differently. They may be able to go ahead and really control things in a much more natural way without, in some cases, any medication at all. We've heard all of those. Those are great testimonials, and they make us understand how effective those particular things are. But not everybody really can walk away clean if they have diabetes or pre-diabetes, because there are all kinds of complications of that particular disease. The most common one is neuropathy, a form of nerve damage that really affects all the nerves in the entire body. And 70% of all diabetics have neuropathy. They may not know it, but they do, and if they're tested for it, it shows up. Well, the thing that's amazing is that we have 100 million pre-diabetics in this country. Of that 100 million, 50% of them have neuropathy starting or progressing, even though they've never been diagnosed as being pre-diabetic yet in most cases. So we have a major problem going on in terms of neuropathy. What about nerve damage? I mentioned that term. Well, there's all kinds of nerve damage. Nerve damage can be problems relating to the back and neck. Nerve damage can be chronic carpal tunnel syndrome. It can be chronic pain of virtually all types. Or it can be neurological problems like Lou Gehrig's disease, amyotrophic lateral sclerosis, or multiple sclerosis, or many diseases that are similar to that. Well, the problem again comes back to, how do you treat these things? We really know that medication is not the answer. On the other hand, I know, and now you'll know, that the answer truly is nerve health support. Well, why am I so confident about that particular product? You know, there are several reasons why this product works to accomplish what we want, and here they are. Number one is the fact that this particular product has the 3 most commonly tested and proven ingredients, natural ingredients, not medication, not synthetic things, natural ingredients that have been shown absolutely to heal and regenerate damaged nerves. And here they are. Methylcobalamin. Methylcobalamin is vitamin B12, but not like the vitamin B12 that you get in your vitamins, in your multivitamins. This is a very, very bioactive form of vitamin B12. It is the only form of vitamin B12 that can get to the nerves and actually create the healing of the nerves. How do these particular things heal the nerves? We know that nerves do heal, but only under the right circumstances. So what are those circumstances? Something has to stimulate your body to create a certain protein called nerve growth factor. And again, going back to what I said about medications, there have been no medications at all that have ever been shown to do that, to stimulate your body to create nerve growth factor. But these particular things that I'm talking about, methylcobalamin and also the other 2, acetyl L-carnitine and alpha-lipoic acid, have all been proven to be very, very powerful in stimulating your body to produce nerve growth factor. What happens then? What we've done is set the stage to allow your body to heal and regenerate those damaged nerves, and that is what occurs. So this particular product is extremely powerful in doing that, but it does more than that. When you get nerve damage of any kind, what happens is that the teeny capillaries, the very smallest blood vessels that bring oxygen, bring nutrients, bring water to the nerve cells, and take away the waste products, they begin to shut down because the body says, well, they're not needed anymore. That nerve's not working any longer. Unless you open that back up so that you create a healthy environment for the nerve cell to function in, you're not going to get healing. So this particular product, Nerve Health Support, has ingredients in it that will open up those circulatory channels and allow the the cell to get healthy nutrients again. Last of all, it also includes vitamins and minerals that have been proven to maximize the conduction of the impulses through the nerves. If you're not conducting the impulses well, it doesn't matter if you're healing it, you're still not going to get your sensation back, you're not going to get your motion back, you're not going to get your strength back. These are the things that this particular product, Nerve Health Support, really gives to your cells and to your body, and that's the method that it uses to create a healing environment for that. Well, that's very powerful stuff by itself, isn't it? But I've got to tell you that there's other factors that can slow down or stop the healing process, and you have to go ahead and eliminate those. It's like going through an obstacle course. You got to get rid of those obstacles. What is that? The main thing is inflammation. We know that when any structure is damaged, that it also causes inflammation of that structure. You know, a lot of us, when we grew up, we knew what inflammation was. You sprain your ankle, it gets hot, it gets swollen, it gets red, it gets tender, it gets painful. All of that really relates to the acute inflammatory response, which is part of how we heal injuries. On the other hand, chronic inflammation does just the opposite. When that inflammation doesn't go away, whether it's due to a chronic injury or due to the way your metabolism is or due to an illness that you have, then that inflammation doesn't go away. And when it becomes chronic, it will either slow down or block completely the healing process. So how do we get rid of that chronic inflammation? Well, we've made it easier for you here in Plexus Worldwide because there are two other products that you're probably familiar with: Fast Relief Capsules and Fast Relief Cream. The main ingredient in both of those is lipronol. Lipronol is a highly concentrated extract of New Zealand green lip mussel. And it really has been found to be the most powerful natural anti-inflammatory compound anywhere. You should use both of those products in conjunction with nerve health support to get the best possible effect. When we use the combination of all three of those products, I call that the Plexus Pain Relief System. And the Plexus Pain Relief System is not to be found anywhere else. This is yours. This is a tool for you to use for yourself, for your family, for your friends, for everybody that you come in contact with. Because, folks, pain is something that everybody has at some point or another. And we now have 100 million Americans that have chronic or recurrent pain all the time. We've got to have answers for them. And the combination of these products is really the best answer out there. So what's the bottom line? The bottom line is that we've got major problems in this country with chronic pain and with nerve damage of different types. Up until now, there's been little or nothing that could be done to help those things. And we have the answer for you. The pain relief system is a very, very powerful tool in your hands. It is even better because none of these things have any side effects. None of these things have any kind of drug interference. So you can take medications that you've been prescribed and continue to take those and work with your doctor to integrate this into your program. And you can do it safely. Last of all, if you haven't had chronic pain, it's hard to realize how that really affects your life. But those people who have chronic pain can really become isolated with their pain. They can become withdrawn from their family, lose their job, lose the hobbies that they love to do, lose the reason and the quality for their life. You can give that back to them. So take that gift, use it well, and I guarantee you, you're going to have a whole lot of unbelievably happy and excited people.